Hello, my name's Simon Constable and I'm an equine vet. This is a video to talk about foaling and things that you can do to prepare yourself. I thought it was quite important. There aren't really many videos around to demonstrate what happens at foaling, and more importantly the preparation and the ways that you can get everything ready to make sure that the foaling goes as smoothly as possible. So we start off obviously almost 12 months ago. 335 to 340 days is the normal gestation period of a horse, so we have a good idea of the due date, and that means that you can then predict when it's going to happen, and more importantly then you can look a few weeks in advance, and often maybe a month, 6 weeks in advance, to make sure that you can prepare yourself for the foaling, and that means getting the mare into the environment in which she's going to foal. That's very important from the point of view of antibodies that she's going to make against the different bugs in the environment, and that may be different depending on where she does that. Also, it gives you a chance to observe her and see what happens with a normal behaviour. Look at the udder development, which commonly will happen or will start to happen at about a month to 6 weeks before, and that usually includes an enlargement of the udder. Obviously, if she's a maiden mare, she will have very little udder previously. If she's had several foals, you may find that she's already got quite a large udder, but you certainly notice a change in shape. Also at that time, it's an important thing to make sure your horse is vaccinated. This allows the mare to pass the immunity onto the foal in the first milk, or the colostrum as it's called. Normally we would vaccinate, obviously you've probably done your equine herpes virus vaccinations previously to make sure that your mare doesn't abort, and they're normally done at 5, 7 and 9 months of gestation. But as we say, about a month, 6 weeks before, it's often a good idea to boost them against flu and tetanus, and that will allow, as I said, the mare to pass the immunity on. So in the intervening 4 to 6 weeks then before the due date, you need to take quite a lot of care with your mare, looking at seeing what's happened. Obviously she needs to go out in the field and be treated as normal, although that can be quite difficult in the winter months, and you may be limited to maybe a few hours a day just to get her out, get her stretching her legs, stop anything like a ventral edema that sometimes happened, and also to again make sure that she's moving about, she's not stiffening up, she has no problems passing droppings and that type of thing. So as we get closer to foaling, as we say, the udder will enlarge, you'll see the development of that, and then generally a few weeks before you need to be preparing yourself that maybe your mare is going to foal, and that involves putting her onto a straw bedding. And the reason for that is that the foal really, when it's born into shavings, the shavings get up the nose. Obviously the foal's inquisitive, will maybe start to eat the bedding, and shavings are not a good bedding for that to happen. Straw isn't a problem, it's obviously can be digested, certainly eventually anyway. So straw is a very good idea as a bedding. It's something I would recommend, even if your horse isn't normally on it. And then as we get closer to foaling, this is when it gets more critical in being observant. Setting up things like a closed circuit TV is very, very important, and that from a mare's point of view, being disturbed all the time, which would involve people getting up in the middle of the night and walking down to the stable and looking in without CCTV, every time you do that the mare may be disturbed, and it may just delay the foaling a little bit. But obviously with a closed circuit TV camera you can see them all the time, and you don't have to disturb them. And because mares, they do have this ability to fine tune when they're foaling, commonly they will be, as we say, the gestation period 335 to 340 days, but there is quite a lot of variance on that, and it can be as little as 325, can be as long as 365, and there is an idea that the foal often determines the time, as in the date, whereas the mare will determine what hour or the time of the actual foaling. So the more you disturb them, the less likely she is to foal. She would prefer to foal at a quiet time. Now that can be during the day, certainly yards where people are at work and there's maybe very little going on, she may foal during the day. If it's a very noisy yard or a normal yard, and she will often foal in the middle of the night, and that can be at any time. But again, being observant and looking out for that just in case she needs a hand is very, very important. So getting down to the last few days, what do we look for? Well, the main thing is waxing up on the teats. That's obviously a waxy substance that can be a sort of a yellowy, white appearance just on the ends of the teats, and can get quite large, even the size of a small grape sometimes. And that is generally a very good sign that foaling is imminent. And when we're talking 24 to 48 hours, but it can be a lot longer. It can be several days sometimes, and it's but again, it's another important thing to watch out for. The other thing is around the back end, where the mare's tail head and the muscles around there, the ligaments tend to relax, and it becomes a lot more softer, a lot more blancmangy, which can be prodded, and it gives quite a lot more. And again, that's a very, very good sign of impending foaling, and again, you need to be on red alert at that time. So this mare has actually already foaled. Thankfully, she foaled about 9 days ago. And we've got a nice colt, but she actually foaled quite an unusual hour, I would say. It was at 7:30 at night. We just finished the yard, and we had a bit of an idea, a behaviour change. She'd stopped eating a little bit. She was very picky, she was very restless, she was turning round a lot, she was kicking at the stomach occasionally. Obviously all signs of colic that you would expect, but is something that perhaps could be interpreted in several ways. But we watched her very closely on the CCTV, and we saw her get down. She started to push, and we were there straight away to give her a hand. So the following video, thankfully we managed to catch this on video. The following video will show you exactly what happened. So this is first stage labour. This is quite an exciting part, quite a stressful part, because you're worried about what's going to happen next. And normally stage 1 of labour, it will last anywhere between 30 minutes and about 4 hours. And at this point I'm just feeling inside to make sure that the foal is coming out properly. That really is both front feet, with the nose in between, ideally with the head up towards the tail and the 2 front feet down towards the mare's hocks. A really, really important part of it, because if that isn't coming out properly, you need to know as soon as possible. So the next part is stage 2 labour. This is quite an explosive part of the procedure, where the mare is actually really quite violently pushing out the foal with strong abdominal contractions. And this would normally last anywhere between 5 and 25 minutes, but on the average it would be about 15 minutes. And I talk about the 15-minute rule, meaning if nothing's happened within 15 minutes, really there's more than likely something going to be wrong, and the mare would need help. So you can see the mare's pushing quite strongly here, her legs are moving up and down, and we've got this small sort of bag of fluid called the amnion. That's a sort of bluey white bag that comes out, and you can see the foal's hooves are coming out as well. This foal was actually upside down, and that was obviously quite a problem. This is an abnormal position where as I said earlier, the foal's head should be near the tail, and both the front feet should be near the mare's hocks, and actually you can see this was actually slightly twisted. If you notice, I'm just putting ropes on there just to help me get some traction on, although you've got to be quite careful how you do that. And one of the things I'm doing now is pulling them, and if you notice, I'm pulling the legs alternatively, meaning that it just narrows the width of the shoulders, and can often narrow the width of the hips as well, and twisting that as well to prevent this what's called hip lock, where the hips of the foal get stuck inside the mare. It's at this point really the mare will commonly foal on its own, but I always feel that I have to give a little bit of extra help, and at this point you can see the foal's tongue going a funny purpley colour, and I always think I like to get them out as soon as possible. Because of my concern about how quickly to get them out, I had to get the member of staff doing the filming to help me at this point. So this is straight after the birth. The foal's lying with the back feet still inside the mare, and the placenta's still attached via the umbilical cord to the foal. At this point I'm just checking that the foal can actually breathe. Obviously he's got his head up, he is a colt, and he's got his head up, and the mare's now starting to take interest. And this is a good time to try and give them time together, allow the transfer of blood from the placenta to the foal. It was quite a cold night this foaling. So this is the reason I decided to give the foal a bit of a rub and try and get some of the wet off, because at this point he was actually shaking a little bit. But if it is a warm night and there are no problems and the foal's breathing okay, it's often a good idea just to leave them and give them time to bond together, and that is a really important part of it. At this point as well, we're concerned about the placenta, and that is hanging out the back end, and normally that would take up to about 3 hours to get rid of. In fact, anything longer than 3 hours is regarded as a retained placenta, which can happen in some mares. Up to about 10% sometimes can hold on to them. Often related to bad foalings, although this wasn't a particularly bad one, even though she needed a bit of help. Or if there's any problems with the mare or the foal, that can sometimes cause a problem. So I can be seen here tying the placenta up, and just with a piece of baling twine. This is to act as a counterweight to try and make sure that the mare doesn't stand on the placenta and tear it and rip it out, or rip it out of the uterus prematurely, which could leave a fragment behind, and that can be quite problematical. So it's quite simple, nothing special about this really, apart from just getting bits of baler twine and tying it up in a lump so that it's not trailing on the floor. You can see there's bits of fluid still in there, bits of blood, but the mare isn't bleeding particularly badly. Obviously this is an area you need to be quite careful. If the mare is still a little bit sore, she may kick out, so it's often careful. You've got to be careful at this point, but most mares are more interested in the foal, and generally, as long as they're standing still, you don't have too much of a problem. So the mare will normally lick the foal and try and stimulate the foal, also remove a lot of the moisture from the coat. As we said, we already had dried the foal quite substantially with the night being quite cold, but again, this is an important part of it, and normally the foal would start to develop a suck reflex within about 5 minutes, and normally be able to make attempts to stand anyway within about 30 minutes, and be capable of standing within a couple of hours without any help, and this is quite an important part to get the foal up and moving. And the next bit is the dipping the navel, which is important to do quite early to make sure you don't get any infection getting in through the umbilical cord stump. So the foal sucking is a vital part of the foal's initial development in the first few hours, and it's very, very important from the point of view that the foal must get the maternal immunity in the first milk or colostrum. That's got all the antibodies that will provide the foal's immunity for the first 5 to 6 months of life. And it's very important that they do get on. Normally they would start sucking within about 6 hours. And it's important that you check that they are sucking properly, that they've actually got the mouth on the teat and they're sucking milk rather than just sucking on the leg or sucking on the udder in some other area. But as I say, it passes the mare's immunity in the form of immunoglobulin G directly into the foal's gut, and then it's absorbed up to about 6 to 12 hours directly into the foal's bloodstream. Longer than this time, particularly longer than 12 hours, they cannot absorb it quite as well, and that is when it becomes a problem. The foal will not get enough immunity, and it then may end up with getting infections. They normally need a minimum of 8 grams per litre of immunoglobulin G in the bloodstream. One of the most important things about foaling is to make sure that the mare's got rid of the afterbirth in enough time. Normally we would say around about 6 hours we start to get concerned. In fact, most mares will have already got rid of the afterbirth well before that, often within an hour or two. So if they've not passed it by 6 hours, we often have to give them a hand and remove it. And it's very, very important, whether you remove it or not, at some point you check that afterbirth and make sure that you've got everything with it, because there are problems if some of the afterbirth is left behind. You can get a very severe toxemia, which generally can make the mare very sick and can even cause things like laminitis, and can be very, very serious, particularly in heavier mares, draft mares that are particularly prone to it. So we'll just go through now, looking at the afterbirth and looking at the layout and the way it's arranged, and in particular the important parts of it. So the afterbirth, I suppose quite obviously, is the shape of a mare's uterus. So you've got this long body starting here at what's called the hilus, which is the area where it attaches to the cervix, and then going up the body of the
uterus, and in this case the afterbirth. Then we've got this horn here, which is a lot smaller horn. This is the non-pregnant horn, and then this is the lot larger horn, which is the pregnant horn, which is obviously the part that the foal will actually lie in. And then attached to that, you've got the amnion. This part is called the allantochorion. This is the amnion. This is what the foal is actually delivered inside of, and it's the thing that we would open first of all. So, looking at this, what are the main areas? Well, it's the ends of these horns that are the main problem. This is where the blind ending sac ends, and these are the critical areas, particularly non-pregnant horn, but even the pregnant horn. As you can see, it's a blind ending sac. It's like a sock almost, and that must be intact. If any of that is lost, and these are the areas that may be left behind when the mare cleanses, when the mare gets rid of the afterbirth. And so if those are left behind and they lead to a piece remaining in there, it will very quickly putrefy, and then, as I said, the mare can become toxemic. So if we're examining, sometimes you may see these sort of quite odd things that may occur. These are what are called Hippo Manes. These are just an accumulation of tissue that's in there from the amniotic fluid, and these are often found with the foal. These are regarded as a fertility thing, but it's certainly nothing unusual to worry about if you do find these types of things. It's not the foal's liver or anything, which is certainly what's been mentioned in the past.
Going out in the field is an important time for a foal's development, to make sure that they develop the strength in the muscles, the bones, the tendons, the ligaments, and box resting a foal for prolonged periods of time is often not advantageous unless there is an underlying orthopaedic problem that necessitates that. Fencing is very important as well, and barbed wire or electric fencing should never be used in this situation in case the foal runs through it, which it may well do with not being used to being in the field. We hope you've enjoyed the video. Obviously mother and baby doing well at the moment. There's still a long way to go, and there's a lot of trials and tribulations, I'm sure, but certainly we're delighted with what we've got. Nice little colt. He's becoming a little bit cheeky now. He's a couple of weeks old. If you do need any more information, our website is www.equine-vets.com, and there you'll find more detail about other things to watch out for, things like urination we've not mentioned, what to use in the umbilical cord dip. But yeah, we're happy with him, and we're certainly going to enjoy him, so we hope you enjoy your horses too.